My presentation topic is, first of all, thank you organizing committee and Kiran team for organizing such a informative and excellent event and giving me opportunity to be here. My topic is very lengthy, but I will try to cover all topic within 10 minutes. Topic is getting versus non-getting. Silent, please. Students, मुझे पता है कि स्टूडेंट्स ज्यादातर से टॉपिक हटके होगा, लेकिन प्लीज सुन ले थोड़ा सा, शायद समझ में आ जाए. सो what is getting treatment? It is a simple method and technique which we use to treat the moving organs, because in our body we have many organs that move during the radiotherapy, and it is very difficult to deliver the dose in moving organs. So this is a just layout of my presentation, and two kind of moving organs we have, two kind of movement we have in our body. One is due to breathing, and another one is peristalsis. ब्रीथिंग सबको पता है, सांस लेने से, और पेरिस्टलिसिस जो है वो रिलैक्सेशन ऑफ मसल्स को कहते हैं, या किसी फ्लूइड या किसी गैस के थ्रू किसी चीज को पुश करने को कहते हैं. तो इससे दो तरह की मूवमेंट होती है, और यही हमारा प्रॉब्लम रहता है. It is still challenge nowadays in the field of radiotherapy how to deliver radiation to the moving organs. So different kind of movements we have in our body, like in this study we can see liver movement, lung movement, prostate movement. These kind of movements we can observe and see during radiotherapy. So there are three places where we observe these kind of issues and artifacts. Radiotherapy always start, most of the time it starts from the diagnostic imaging. Diagnostic imaging can be CT, MRI, and PET CT imaging. So first part is image acquisition limitation. There are few limitations, like when you use your normal CT to acquire imaging of moving organs, then you can miss some information of the moving tumor. If you are using diagnostic CT for diagnostic purpose, then it is okay, because radiologist or physician only want to see the size of tumor, and in normal CT you can measure your size of tumor. But when you talk about the radiotherapy, in radiotherapy we require the imaging that can cover the movement of the organs. In second part is the treatment planning. These images we shift or transfer in the TPS, treatment planning systems, where we again have some limitations that we will discuss in presentation. Last one is a radiation delivery limitation. If everything is fine, imaging is good, treatment planning is good, but delivery is not good, then all procedure will be useless. So in imaging, we have two kind of artifacts. One is due to time mismanaged between respiratory cycle and time of acquisition of the CT. Second is a motion artifacts. Due to motion, we acquire the blood image of tumor. We cannot acquire and perform complete information about the tumor in CT. So these two images shows what a difference between getting and non-getting. A represent a normal CT and B represent 4D CT. In 4D CT, tumor is very clear, but in figure A, tumor is not clear. It is a blurred image of the CT. So one term in radiotherapy used is the interplay effect. What is interplay effect? Whenever we talk about the moving organs in radiotherapy, then we face the interplay effect, because due to this effect, we delivered and we irradiate the extra portion of the tumor. According to ICIU 62, one new word introduced is the ITV. ITV solved this issue, but for this whole process, we required a very dedicated motion management system in our institute. So here we can see, suppose red one is a tumor in first one figure, because it's an old technique. In old technique, what was happened, you can use a larger aperture that can cover all the movement of the organs. But in this technique, what is the disadvantage of this technique? In this technique, you irradiate the extra portion of the tumor. When you use a very less margin around the tumor, very precise treatment, then you require a very dedicated motion management system in radiotherapy. So This chart shows the summary of these all processes, means what kind of control system, motion management, and methods we can use to control the motion management. First one is a free breathing. Free breathing city is a normal city. You can use that one city, but here you can't see the whole extent of the tumor movement. But if you want to use the same city for the same purpose, then you can use, but there are two ways. One way is you can use the slow city. You will increase your timing. जब आप slow city use करेंगे तो ट्यूमर का exact extent आप देख सकते हैं. Other method is you can acquire multiple city images for the same patient. एक ही पेशेंट के आप 10 मरतबा इमेजेस लें, उन सबको एवरेज करें, तो उसमें भी आपको ट्यूमर की पूरी मूवमेंट नजर आ जाएगी, लेकिन उसमें इन पेशेंट्स को डोज ज्यादा मिलेगी. तो सही मेथड क्या है? व्हाट इज अ राइट मेथड टू सी द एग्जैक्ट एक्सटेंट ऑफ द ट्यूमर मूवमेंट? फर्स्ट वन इज अ इनहेल एंड एक्सहेल टेक्निक इन सिटी. लाइक समटाइम यू ऑब्जर्व इन सिटी, वो जब स्कैन हो रहा होता है कहते हैं सांस रोक ले, तो व्हेन यू होल्ड योर ब्रीथ तो ट्यूमर रुक जाता है, तो उससे उसकी आप एग्जैक्ट लोकेशन देख सकते हैं. फोर्थ है गेटिंग सिटी. तो आई फोकस्ड ऑन 4D सिटी बिकॉज वी हैव इन आवर इंस्टीट्यूट दिस वन सिटी. तो 4D सिटी जो है इसका सही मायनों में सोल्यूशन है, जो कि एग्जैक्ट उसकी मूवमेंट दिखाता है. एंड में टाइम हुआ और एक वीडियो चली तो मैं आपको वीडियो में दिखाऊंगा. फिफ्थ मेथड है ट्रैकिंग. ट्रैकिंग में क्या होता है? सम काइंड ऑफ फिड्यूशियल implanted in the body or placed on the body. So by detecting that what fiducial markers, we can detect the location of tumor. Chhata hai ABC method, and seventh one is a gating and symmetry. We have symmetry software in our institute on Linux to deliver the radiation in moving tumors. So these are the advantages and disadvantages of these techniques. These are main 4 basic classes that cover the moving organ treatment in radiotherapy. Shortcut we will see. This is a basic principle on Linux, how it works. You set a gate. What is gate? Gate is a specific portion of your whole breathing cycle. Gate उसे कहते हैं खास पोर्शन, उसमें ट्यूमर को रखना होता है और मशीन को कमांड देनी होती है कि जब ये गेट का पोर्शन आए तो मशीन बीम ऑन करे, अदरवाइज वो बीम को ऑफ कर दे. तो ये यहाँ पे होता है. ये ABC सिस्टम, ये भी एक मेथड है. दिस मेथड फर्स्ट वाज यूज्ड फॉर कंट्रोलिंग द मूवमेंट ऑफ लिवर के लिए से पहले यूज किया जाता था, बट नाउ वी आर यूजिंग दिस टेक्निक इन आवर इंस्टीट्यूट फॉर controlling the breathing for lung, for liver as well. तो ये है 4 shallow breathing methods. Fourth one is ideal respiration synchronized technique. ये ideal है जो कि real time करती है, लेकिन बहुत कम इंस्टीट्यूट है इनके पास ये टेक्निक है. तो ये जैसे साइबर नाइफ की अभी बात की मैडम ने, साइबर नाइफ में फ्लोरोस्कोपी की डिवाइसेस होती हैं. अगर कंटिन्यू आप बीम ऑन रखें तो आप उसे एग्जैक्टली ट्यूमर के ड्यूरिंग ट्रीटमेंट देख सकते हैं और अपनी रेडिएशन डिलीवर कर सकते हैं. ये सारी टेक्निक ये हम लोग यूज कर रहे हैं. सिमेट्री, ये इसका वर्क फ्लो, ये जो स्टडी हमने परफॉर्म की उसका है, ये रिजल्ट्स, और ये कंक्लूजन, ये रिकमेंडेशन रिपोर्ट्स. थैंक यू.